Right, good evening, everybody. I'm Councillor Graham Bridgman, and I am the Deputy Leader of Council, Executive Portfolio Holder for Health and Wellbeing, and Chairman of this board. And as you can see, it's Mental Health Action Week from the backgrounds that a number of us have up, and we are making great play about that, is quite right. And you will no doubt see quite a lot of information about the week in our tweets and chats and everything else that's going on. I am supported by the Vice Chairman of the board, Councillor Joe Stewart, and the other members in the meeting are Councillors Lynn Doherty, Martha Vickers, and Steve Masters. We also have with us this evening Meriden Peachy, who is the Director of Public Health for Berkshire West, Joe Reeves, who's the Locality Manager for the Berkshire West Clinical Commissioning Group, Andy Sharp, who is the Council's Executive Director for the People Directorate, Matt Pearce, Council Service Director for Communities and Wellbeing, and Sean Murphy, and I was looking for April, don't see her, so Sean Murphy from the Public Protection team. I think we've also got Martin, yes we have, Martin Dunscombe, who is the Council's Communication Manager. And finally, we've got Gordon Oliver, who's clerking the meeting and will be the Zoom host. Now, before I ask Gordon to take us through the standard reminders about Zoom meetings, just a quick comment that some of the eagle-eyed amongst the public and indeed amongst our friends in the media will be aware that there was legislation allowing formal public council meetings to be held virtually, and that legislation expired last week. Although this meeting is very deliberately in the public gaze, we have taken advice, and the advice is that because it isn't a meeting of the type affected by that change in regulation, we can, and indeed we intend to continue to meet remotely for at least the time being. And indeed, how long we will continue to have local outbreak engagement board meetings is something we'll discuss towards the end of this meeting. So, Gordon, can I now ask you to run through the standard Zoom reminders?
In addition to the points shown on the screen, if it becomes necessary for members to telephone into the meeting, you will not be able to signal to speak. So once everyone who has raised a Zoom hand has spoken, anyone who has telephoned in will be invited to speak in order. Any voting will be done via show of physical hands, and if we need to adjourn the meeting for any reason, then you will be advised of the revised time and date of the meeting. If it's a short adjournment, you'll be able to rejoin the Zoom meeting. Otherwise, a fresh appointment will be sent out. Do members have any questions about the way in which the meeting will be run?
I think we're all getting pretty used to it now. Thank you, Gordon. So, first item is whether we have apologies. Gordon.
We have apologies from Nick Carter and Councillor Dominic Bowick.
And I see no one else wanting to add, so thank you for that. So now, members, we have the minutes of the meeting of the 26th of April. Before I come to the rest of you, I have one comment about those minutes, and I look for some guidance from Matt Pearce on this one. Members, on page 5, there's a reference to, I'll read you the bullet. Since the start of the pandemic, the all-cause mortality rate has been 17% higher than the preceding 5-year average, which equated to 248 additional deaths. Now, I don't think we actually were speaking about additional deaths, i.e. excess deaths. We were talking about deaths from COVID, those deaths which had been registered with COVID as a cause. Matt, is that correct?
No, Chairman. So that actually refers to additional deaths of all causes higher than the 5-year average. So they weren't necessarily related to COVID.
Right. Okay. So when because we had a discussion about because I'm looking at the number of 248, and I recall a conversation with you, whether it was in an LOEB meeting or outside an LOEB meeting, about the number being whether it's 248, 250, or 252. At the moment, so that was where I was getting my. So it was just very coincidental if the number of excess additional deaths is 248 as well.
Yeah, I'll have to check.
Can you check that one? Because
Yeah.
I've got a feeling that that is actually what the minute is. There may well be a reference to excess deaths, but I don't know that the number's 248. But let's note that, take it away, and understand it. So, apart from that comment, members, does anyone else have any amendments they want to propose to these minutes? I see no hands. So I will now propose the minutes from the chair. Does that find a seconder? Councillor Doherty, thank you. So I put that to the vote. Physical vote, please. Hand in front of the screen if you are in agreement with the minutes. Gordon?
Yes, that's fine. Thank you.
Thank you very much. And I'm happy for my electronic signature to be added to the minutes, Gordon. So, members, next, declarations of interest. Gordon, have we had any declarations of interest lodged?
None have been received in advance of the meeting, Chairman.
And I'm looking again for any hands. I don't see any. So let us move on. Thank you. Right. So the first substantial item on our agenda this evening is an item on events and gatherings, and Sean is here to give us a verbal report on arrangements for managing public events and gatherings as the COVID restrictions are relaxed. Sean.
Thank you, Chairman. I've got a short presentation, just 3 or 4 slides, if that's okay. I'll just share my screen. Is that showing? Okay, thank you. So yes, I mean this seemed like a good opportunity to talk about this whole issue of events and gatherings as we go into the kind of spring and on through into the summer season when a number of these things are planned. So just a reminder for the board and for those watching that gatherings currently are controlled by the regulations are in place, the all steps regulations, of which step 3 was announced today as in taking effect from the 17th. Primarily where we are is that the gatherings, and when I talk about events, I'm talking about gatherings as well, are banned unless they're permitted by the regulations. But there are various types of permitted gatherings. So they include things like weddings, funerals, wakes. And as you saw today, basically in the announcement, a number of the restrictions on numbers relating to those have been relaxed. One such permitted gathering are events, and even in step 2 and in step 3, basically they are permitted to take place subject to certain restrictions. First of all, the first requirement is that they must be organised by a business, a public body, a charity, benevolent or philanthropic organisation. So effectively this rules out members of the public just organising their own gatherings. And there's a reason for that, because clearly basically the regulations envisage somebody taking responsibility for the safety of the people attending that gathering. The second restriction is that they are subject to not just health and safety risk assessments, but to a very specific COVID risk assessments. And that risk assessment has to take account of any relevant guidance. So at the moment, there is guidance that are issued in relation to events. But for example, there may be other relevant guidance should the situation change, for example, in a different area and people are not allowed to travel out of that area. And we did have that in relation to events at the tail end of last year when people were in different tiers in different parts of the country. There were restrictions on travel. The other thing to say is that basically where an event is a licensed event, that the rules also run in tandem with the licensing objectives under the Licensing Act 2003, one of those objectives, of course, being public safety. So where are we in West Berkshire at the moment? Well, as of today, we currently have notified 130 such events. 8 have already happened, so this is 130 future events going forward. There's a whole range of matters in there, from theatre productions, exhibitions, through to grassroots sports. There's a clear emphasis on outdoor events, and you will have seen some of the announcements over the last couple of weeks around outdoor events by the Watermill, for example, by the Corn Exchange and their planned season that's coming up. They're managed through the Safety Advisory Group, which is a group that basically has existed for a long time to look at safety aspects of all events. And that is basically chaired by the Council, by the Public Protection Service. The members of that group are made up from the Public Protection Service, primarily environmental health officers, but also licensing officers. There are colleagues from the police, from public health, who were never really members of that group, but clearly have come very much to the fore in the last 12 months. Highways, ambulance, emergency planning, etc., and others as necessary. With the Safety Advisory Group consider, for example, the event plans, but they also consider the health and safety risk assessments and COVID risk assessments, which are submitted in advance for consideration. And should it be felt necessarily, basically, the event organisers are then asked to attend Safety Advisory Group to run through the event and to answer any questions and to receive any advice that members of the group may wish to offer. The role is to advise and not approve, but the council does have powers to issue directions and prohibitions. And I attended this board back in the autumn of last year when those powers came into being. But just as a reminder, one of the options we have, or one of the powers that we have, is basically to prohibit certain events taking place, or to put restrictions on the nature of the particular event if it was felt basically that it was unsafe due to coronavirus transmission. That would take account of, for example, the view of the Director of Public Health. And ultimately, basically, we have the power to issue either a direction or a prohibition. It's not a prohibition on people attending, it's a prohibition on those, or direction on those attending, but it's a direction or prohibition on those basically organising. So finally, just to kind of sum up where we are, there are further considerations, obviously, which are coming to the fore as we look at the risk assessments that are submitted to ourselves and to the Safety Advisory Group and public health and environmental health colleagues. So the kind of things that we're looking at are prevailing infection rates. We're looking at the whole issue of testing and where that fits in with events. And obviously, we've got the issue of variants of concern that we have to obviously keep an eye on, and whether variants of concern are an issue in a particular area, or in this case, our area. We've also got the government pilot programme that's running, and there's been a number of high-profile events over the last few weeks held under that pilot programme, and the learning from that pilot programme and how that will fit in basically with risk assessment going forward. There are issues around restrictions on numbers attending and where that fits in within the legislation and within the guidelines. But what all of this means is that basically we have to keep and maintain a rolling review of risk. So events that are coming through now, basically to take place, for example, in 6 weeks' time, we'll be looking at the risk assessments, but obviously what we're advising organisers is to keep under review those risk assessments, as we ourselves do. So we've not just got the work at the moment in terms of carrying out those assessments, taking a view on those risk assessments, but working with organisations to make sure that basically the risk assessments remain relevant at any given time. There is also the issue of compliance checks, and we have a programme planned basically for the year as to which of the events that we believe, based on risk, we do intend to attend ourselves. And there will be a fair number of those. We will carry out kind of checks, work with organisers to make sure that basically the risk assessments that are in place are being complied with. Because at the heart of all of this is public confidence. Obviously, basically, the organisers want these things to go well. They want them to get off the ground. But basically, the public need to be confident that they are properly arranged and the risks are properly managed. And therefore, basically, we see ourselves as part of that whole process of providing that public confidence. And finally, the question really is what happens beyond June. So what we do know is that basically the regulations are in place now until the 21st of June as the earliest kind of date. But what happens beyond that is there's still going to be requirements around COVID risk assessment. Of course, health and safety requirements will still be in place. Licensing requirements will be in place for licensed events. But there is still at this stage basically some uncertainty about what happens effectively, I suppose, in what we would term step 4. So that's basically a quick run through of where we got to, Chair, and I'm happy to answer any questions.
Thank you, Sean. Before I see if members have anything for you, just a couple of questions. Firstly, in terms of the the government pilot program, how does the data, how does the messaging, how does the understanding from that filter down to you on the ground locally? So what are we being told about how those things are going? And secondly, in terms of the current situation with the COVID regs, who is actually making who ultimately makes the decision whether something is safe or not? Is it the entire segment? And if a decision is taken to stop a proposed event, under what legislation are we doing that?
Okay, Chair. So to take the first question around the government pilot events, I mean, the assessments basically will be being compiled now. As you know, these events are fairly recent. We've had a range of them, from kind of indoor snooker tournaments to you know, the events, the nightclub type event that we had last week, and a number of outdoor sporting events, football matches, where basically significant, well, a number of numbers have been admitted to them. So we haven't actually seen the details of that yet, but clearly, basically, obviously, we're anticipating that will come through with any proposals for changing guidance or any suggestions for those basically that are looking at the whole issue of events or planning them. Moving on to the second point. The reason why, obviously, so if you go back to where the controls lie in the what's called the number 3 regulations, basically, which allow local authorities, enforcement authorities, basically to put these prohibitions or directions onto events and gatherings. The way that we're approaching this is to say to ourselves, to determine whether that is appropriate to do so, obviously we need to carry out a review of what is being planned, of the assessments that have been prepared and that are being put before us. So we see effectively it's almost a kind of negative licensing system, in a sense, that basically it is permissible until we're of the view basically it presents too great a risk to be admissible, or we're of the view that basically certain things need to take place. I mean, we haven't actually come across this yet. I think what we're finding now is that there's been a lot of learning from the last 12 months by event organisers. And we have learned a lot as well, basically both ourselves and public health colleagues, as a result of things like outbreaks and things like this, about where things can go wrong, and working with the organisers and their advisors, health and safety advisors and such. I think we are able to get to a point basically where we're satisfied with the assessments that we've got.
Thank you. Councillor Masters.
Thank you, Chairman. Sean, you talked about the pilot scheme, as Councillor Bridgman has just mentioned. Is there any national pilot events scheduled for West Berkshire in the coming months?
I'm not aware of any, Councillor Masters, no.
Thank you.
Yeah.
You're muted, Chair.
I do apologise, members. I should know better, shouldn't I? Sean, thank you very much. And that's item 4. Item 5 is a vaccination update, and I'm looking to Joe on that. Hello, Joe.
Hello. So you've seen this update a couple of times now, so I won't go through in forensic detail, but I'm sure some members may want to query things. So just to note that this data was pulled into the slide deck on the 7th of May, so on Friday, and the data was extracted from clinical systems between the 4th, 7th of May. Data reflects the picture 4 days prior to the date run, so it has potential to be a week out of date or so already. Oh, there we go. And just to reiterate that about 90% of the West Berkshire resident population is picked up in this report. So this is the headline slide really, to advise that 63% of West Berkshire's adult population has been vaccinated. That's up 4% from 2 weeks ago when it was 59%. And the majority of those vaccinations have been second doses. So with 23% of the population now having had their second vaccination. And we're comparing pretty well compared to our partners in Buckinghamshire and Oxfordshire, and overall for England. The slight fluctuation in sort of percentages is due to kind of dates extracted from clinical systems. Sometimes and just that time for the data to feed through. Overall age of population can be a factor as well. So this slide you'll be familiar with, giving a RAG rating of where we're at with the particular age cohorts. So you'll be used to these bottom 4 being green and making good progress through the 40s to 50s now. I think last time we were looking at fewer than 10%. Now we're looking at about 50%. So making good progress through the latest cohort that the vaccination programme has been opened up to. And you'll be used to this slide, which is a breakdown via age and ethnicity. So just starting to see take up among the 40 to 50s here. As usual, or as we saw with the other age cohorts, white British population tend to come forward rather quickly to take up their vaccination, and other ethnic groups catch up after a couple of weeks. And we seem to be seeing that playing out again among this age group. But as ever, wanting to encourage as high a take up as possible among all age and all ethnic groups. So if any particular actions need to be undertaken or messaging, then that will be done. By particular at-risk groups, this slide is getting rather busy as there's a breakdown between first dose, second dose and overall. So for example, in the 18 to 19-year-olds, patients coded at high risk of COVID-19, 47% have had their first dose only so far. The 42% have had both doses, meaning 89% overall have received any number of vaccinations. And overall, 70% of high-risk patients and the housebound have had their second dose, so making really good progress among the more vulnerable of those cohorts. And finally, a breakdown among a couple of our more deprived wards. Again, we're seeing pretty equivalent take-up so far among the 40 to 49-year-olds. Potentially Greenham is slightly behind, but I would want to wait another couple of weeks for when we've really had the vaccine supplies in order to see whether there is any kind of statistically significant variation of take-up among those wards. But overall, looking positive. I suppose a couple of updates that aren't on my slides. It was announced last week that the vaccination centre at Newbury Racecourse will be closing once the practices have finished completing second doses for those patients, with Boots in Northbrook Street open this weekend offering COVID vaccinations, and a further pharmacy site taking on a unit in the Kennett Centre. So good options in the town centre for the under 50s to get their vaccinations locally. The Pangbourne Centre is still up and running, looking at the under 50s, and have been doing so for a week or two now, and they're doing really well. And finally, plans are still going ahead with potentially pop-up clinics. So if there are any particular areas with lower take-up because of lack of access to where the vaccines are located, we can be fairly agile in getting pop-up clinics to visit those particular locations and get patients booked in to make sure they don't miss their opportunity to get their vaccine. And I think that's all I wanted to cover, but happy to take any questions.
Thank you, Jo. I do have a couple of questions. Can we go back to the slides? Because I'll take, but before we get to the slides, do you want to say something about the, I'm gonna get this right, the imbulance or imbulance?
Yeah, it's, I think they've not decided the branding yet. I've heard Vaxibus, Immubus. Essentially, what's being pursued are 2 minibuses / large vans to be shared with partners in Buckinghamshire, Oxfordshire, Wokingham and Reading. They'll be available on a rotational basis. So that would be the mechanism by which pop-up clinics could be staffed and have a vaccine supply. So they would have capacity to do around, I think it's just over 100 vaccinations in a day, with sort of travel time, etc., factored in, and any clinics hosted would need to be pre-booked, and the patient would have their second vaccination for the 11-week period booked in at the same time. So the bus will be coming to West Berks at some point in June, and we're identifying the best sites for that bus to go to. So I'm very happy to take any feedback and ensure that we can personalise that kind of programme and destination to make sure it goes to where it's really needed.
Thanks for that. And now to my questions come comments. On the page you're on, and I think 2 pages back, we have the amber or yellow at 40 to 49. But of course, I simply make the point, and as a question to you to confirm or correct me, that this is a cohort that haven't yet fully come through. So we're not, we haven't got to the end of that 40 to 49 age group yet, and therefore we would expect the number to be less than the numbers that we've had through for the other age groups. And so it's not surprising that we have had fewer percentage through as yet compared to the older groups. Is that correct?
Definitely, yeah.
Okay.
There's
now,
also
sorry, carry on.
There's also been slightly less supply over the last few weeks for first doses. So the rate of increase has been slower than we've seen with previous cohorts, but I expect that over the next couple of weeks, the rate at which that take-up rate is indicative will accelerate.
You were. I don't know about others. You were breaking up there for a bit. I'm having nods from the rest of the group that your audio broke up a little bit at the end of that. Let me take you back. I think one screen, Joe.
I think we may have lost her.
Well, she's managed to keep her screen share up, which is quite a feat. There's something going on in the world of Joe Reeves. Oh, bye, Joe. I'll save that question for another day, members. And Councillor Doherty, maybe you'll have to save your question for another day. We'll have to see whether Joe rejoins us and we get the opportunity to ask her. So bear with us, members. Okay, we'll move on and come back to Joe if she manages to rejoin us. Members, we next have COVID-19 situation, and that's Matt.
Hi, everyone. So just going to take you through this evening's slides. So again, the slide you're always familiar with is the picture across Berkshire. So again, we have the local authorities on the left-hand side of this table. The individuals tested, individuals test positivity, cases per 100,000 and case per 100,000 per population. Obviously, I think it's obvious that we have seen quite a significant rise in West Berkshire over the last few weeks or so. So in terms of our positivity, that now stands at 1.1, which is both higher than the regional national average. And our cases per 100,000 now stands at 30.9. So again, that's nearly a doubling over the last week or two, which represents, again, higher than both the South East and English average, which is around 14.7 and 21.4. And I'll go into a bit of the detail of the data in terms of what we think might be driving that in a minute. In terms of the cases per 100,000 for 60 or older, that stands at 9.9, so a slight increase in that rate. And then the number of confirmed cases for the last 7 days is 49. I think the latest data has just come out this evening, actually just puts our case rate now at just under 30. So it's coming back down a little bit. So just going into that detail that I just talked about. So this just really dives into that detail. So again, we've just got West Berkshire here. These are the last 3 weeks complete data we have. So again, it was at 15.1 per 100,000 on the 20th of April. Obviously from the 27th, that went to 16.4. And then we've seen that big jump up to 30.9. And again, the graph just shows that in terms of how that relates to the national and regional average. So the blue representing West Berkshire line, the southeast is the orange, and England is the grey. So you can just see that blue line just going above both the regional and national average. One of the key things we need to remember now is that the numbers are relatively low to what they were. So any significant increases will see quite large swings and variations in that data. If we go down to what those recent cases have been, this graph just shows the dates at the bottom, the number of cases, and what we've actually done is split it out into those that are actually school age, just to give you a sense in terms of what might be driving some of the most recent community transmission. So what we've seen is cases have started to rise with the week ending 2nd of May. We've seen 100% rise compared to that week before. And 41% of cases in the week ending 2nd of May were from school age children. What's helpful with this graph is whilst we've had 46 cases from that week, obviously it does put it into context and perspective when you go back to January when we did have a significant number of cases. So whilst all rises are significant and concerning, again, any single outbreaks, and we did have one specific outbreak in West Berkshire in a school where there were 10 cases. So you take those 10 cases off 46, that quickly becomes 36. So it just shows you how the numbers can swing. We also looked at the analysis of the recent rise in cases down by ages. So again, we looked at this across all local authorities just to see how we benchmarked. So each of the local authorities on the left-hand side here, if we just look at this top table. And then for each of the weeks, we looked at the proportion of cases who were school age at time of test by local authorities. So as you can see towards the end of this table, as I said, on that week, there's around 41% of cases were school-aged children. And that varies, but we're seeing quite a significant rise, particularly in 16 to 18-year-olds. So that's something we need to monitor closely. Already some of the data, the live data we're getting in now, although not fully complete, has shown a bit of a drop-off since then. But again, largely down to that outbreak I mentioned. And then the total cases on the bottom of the table just gives you a sense of those total numbers. The numbers might vary to what I'm talking about just in terms of the time ranges that we're looking at. And then obviously we look at the geographical spread of a transmission. And as you can see from this graph, this is down to local super output area. It's quite a smaller geographical area. And again, there's not really showing any hotspot that's coming through from the data. So those areas that are in green are just showing 1 to 4 cases in those LSOAs. But if you remember right, in maybe the first and second wave, we had quite darker shades of green representing higher numbers in those specific areas. So all in all, we don't really have any general sense of what might be causing our high rates. It could be maybe next week and the week after it goes back down. I think we have to recollect that we came from quite a low baseline, particularly in the 19 to 29-year-olds 3 to 4 weeks ago, and it could just be a rebound in that sense. But obviously, we need to compare ourselves to other local authorities in the country, and that's something we're watching very closely over the coming days and weeks. In the deaths, and I'll just quickly modified this slide to hopefully clarify the point that was raised as part of the minutes from the last meeting. So there have been 252 COVID-related deaths. So these are all deaths that occurred with COVID on their death certificate within 28 days during the pandemic. But thankfully, no new deaths have been recorded since the week ending the 26th of March in West Berkshire. And then when we look at the excess mortalities, which we were talking about before, so there's been an 18% increase of all deaths compared to the 5-year average. And that does actually equate to 247 deaths. So you can see some similarity between the numbers there that might lead to some of that confusion. So I'm very close indeed. But as you can see at the moment, our death rates are in line with what we'd expect to kind of see this time of year at the moment. In terms of hospital activity, again, this obviously slightly dated, but we're seeing that it's leveling out now in terms of hospital activity. I think there's only been one admission as of the 7th of May across all of our 3 local authorities, all the 3 hospitals, Frimley, Royal Berks, and the other one which I've completely forgot, Wrexham, sorry. And that concludes my presentation. So again, if you want to see more data, go onto the Berkshire Public Health website. But I'm happy to answer any questions because I know some people might have some concerns around the rise in rates at this time.
I'll come to Councillor Doherty in a moment, but if I take Chairman's privilege, firstly, Gordon, you can leave the minutes alone because obviously we had 248 and 248. There's the confusion. So at least that's explained that one. Thank you, Matt. Yeah, I guess the point I would make, and I'd look for your input to this, is it's the effect of COVID now on the general population, the number of people who have been vaccinated, the ages of those who have been vaccinated, and therefore the question of hospitalisation, that we may have what is a concerning rise in the number of cases, but I guess it's the effect of that on the health system as much as anything that I'd be interested in. And it goes to the questions to living with COVID into the future, and maybe whether you have any comments on that.
Yeah, I think there's a range of comments, and Meredith might want to comment on that as well. I mean, clearly the rise in community transmission isn't yet translating into hospital admissions or deaths, although we always see a delay in that. It's focusing on the younger age groups, which we know are less at risk, although there's still lots of unknowns around long COVID. I think it's really important, though, that we still have to continue with the restrictions in place. Obviously, we're following the government roadmap. The more community transmission there is, the more likelihood there could be of new variants as that virus transmits through different individuals, and we're seeing that in India and those risks posing through that. So I think there will come a point, I'm sure, where the government and local authorities find a level that's kind of, like you say, living with COVID. We don't quite know what that threshold will be at the moment, but I think we clearly need to follow those restrictions as much as we can, because there's still lots of unknown about the effectiveness of the vaccine and how it can prevent transmissibility, although the evidence is suggesting that actually it does have a good impact on that. Meredith, did you want to add any more from what I've just said?
I would just support what you said. I think there will be a threshold at some point on what it means to live with COVID, because it's not going to go away completely. But in terms of long COVID and how we live with the effects of COVID, the research community are doing a huge amount at the moment. There's quite a lot of research looking at people who are coming forward with long COVID and looking at their symptoms, looking at how long the effects. And I think NHS services in particular are going to be altered and amended to account for that. I think the other one is there's quite a lot of research being done on the effect on children and their learning education. I mean, there's one piece of research that's come out suggesting that children in the more deprived or in the lower income brackets are falling further behind in things like maths. So I think we'll look very carefully at some of the evidence and the research, and then I think we need to tailor our resources according to that. So I think it's good. And the National Institute of Health Research, they've got huge amounts of money that are going into this at the moment. And there's lots of research fellowships being offered for people to look at COVID and the effects. So I think there's a lot of places we can get advice in terms of how we can help people over COVID. And I think some of the approaches that West Berkshire is taking around resilient communities, that's one of them. This isn't all about what the public sector does for people, it's what communities do for themselves. So it's about how we communicate with communities, what's the effect, and what can you do for yourself. So it's very multifactorial at the moment.
Thank you, Meredith. Councillor Doherty.
Two questions, if I may. Matt, we've obviously been doing this for some time now, and you mentioned that the schools and the age of the increased numbers and a couple of outbreaks there. Within the outbreak plan and the work that you're doing with those particular outbreaks, is there anything different? Are those schools doing anything different to what's previously been done, or do we think this is just it's just one of these things, or is there something standing out in those particular outbreaks? Would be my first question.
I don't think so. I know we worked with Sean and we worked with health and safety, and often even previously when we've gone into schools, it's normally quite difficult to put our finger on actually what is driving transmission. Are there things the schools aren't doing right? Generally, they do tend to be pretty compliant. My own observation is obviously with that Kent variant. So when we go back to November last year, we saw quite a rapid increase, and obviously the restrictions then came in beginning of the year. It could be that Kent variant is now still as potent, and it's just going through schools. We obviously continue to work schools. One of the things I didn't probably mention is testing, and obviously that's different in schools now. So we will be identifying more cases through regular testing, but again, that will apply to the rest of the country as well. But nevertheless, our testing rate is actually lower than a lot of other parts of the country. So if there's one thing I think we need to work more on with our community partners in schools, and it's not just testing children, parents as well, and playing our part as we begin to live with COVID.
Well, that was going to be the second part of my question, actually, around, obviously, and it ties into Meredith and what she was saying about community response as well. We've heard this evening that we're moving ahead with the next sort of step on the 17th of May. And what is it, and what is the message we need to be getting out in West Berkshire between now and then around what our communities need to do and our residents need to do to take accountability around making sure we continue to drive those numbers down before we take that next step? So that was sort of tied in. Is there anything else other than the testing side that you think we need to be doing?
The only other thing is, obviously, we know a lot of transmission is through household transmission, and obviously the next step of the restrictions is allowing one other person or family to go in to see another household. So I think we just, be common sense, with that respect, in terms of increased ventilation, trying to keep your distance, wash your hands regularly. If we can maintain those things going forward, that's going to play a part. Obviously, regular testing really important. I think sometimes when people think the prevalence is low, they don't need to get asymptomatic testing, but actually we need to keep it low. So actually regularly testing children and adults, that will play a really, really key part. And when you're out and about, obviously wear the face covering. So all those things we've done over the last 9 months, we need to keep doing those. And then the government will advise, as needed, when we can kind of, maybe take away some of those restrictions and the evidence is more clear about the impact of the vaccine.
Thanks, Matt.
Councillor Masters, if you hang on for a moment, because I see Sean's got his hand up and he may have something to add into that before I come to you. Sean.
Yeah, thank you, Chairman. I was only going to pick up actually on a couple of points from Councillor Doherty on the issue of the outbreaks and notified cases within risk settings. We do actually look at every single one of them that comes in. What I would say about the schools one is most of them are actually isolated, aren't they, Matt? They're normally just one case, maybe two, and obviously, as Matt has alluded to, basically one particular outbreak. Just moving on to your second point, Councillor Doherty, about what can we do about the 17th? Obviously, being involved as we are as a service with working with the businesses at reopening, and obviously we're moving into a higher risk, I suppose, basically as we move into step 3 with basically indoor mixing for the first time. What I would say is that the public obviously also have their role to play. So that a lot of work is being done by businesses across the district to put in place the measures that are required by the guidance and by the regulations. But I think it's really, really important to stress that the public basically also need to comply with those rules if we're to try and make the premises as secure as we can. Thank you.
Councillor Masters.
Thank you, Chairman. I was going to ask some similar stuff to Councillor Doherty, but just for in addition, the age range of the school outbreaks and stuff, Matt, is it something to do with understanding with younger children, not necessarily understanding the risks, about mixing in the playground, for example? I know there's supposedly bubbles and everything else, but with the best will in the world, younger children are not necessarily going to understand the risks, and and they're going to want to see their pals at school and play with them. Is there a greater understanding and a lower risk as school age increases?
I'm not sure. I mean, it's difficult with schools, isn't it? Throughout this pandemic, we've had the whole, risk of health and education and weighing up those benefits. I think it is difficult, particularly the younger children, to keep them to be socially distanced. Obviously, what we don't do is regularly test primary school children. There's obviously reasons behind that. Secondary school children, obviously, we do test regularly, or they should be testing regularly. So I think in primary schools, I think some of the messages we're trying to push out is actually parents, particularly primary school children, do have access to asymptomatic testing. So whilst we won't necessarily test primary school children unless they're symptomatic, I think we'd be strongly encouraging parents to play their part, to test themselves, because that would be really important. But again, as Sean said, we work closely with schools, they follow the guidance, they try and comply as best they can.
You mentioned that the testing rate was a bit lower in West Berkshire. What's been done to increase that testing rate?
Yeah, I mean that's been a bit of a recurrent pattern actually throughout the pandemic. That can be down to our lower rates. We generally had lower rates compared to the rest of the population and regional and national average. But we've been doing a lot. I know Martin might be able to allude to more in his update. But obviously we do the community collect now, so we have a car driving around distributing testing kits. We've also been advocating people if they're symptomatic to go and get tested. Pharmacies are now distributing testing. So yeah, I guess for us, it's really making sure people are aware how they can access testing, making it as easy as possible for them to get their tests, and then also educating them to understand that actually they have a role to play to test themselves. Even if they don't have symptoms, they have to regularly test using lateral flow devices. So I'm sure Martin might be able to maybe give a bit of an update in this agenda item.
Thank you, Matt.
Thank you, members. I think that's the end of the questions for Matt. I can see that Jo Reeves has rejoined us, but not on camera. So what I suggest is if we have questions for her further to the presentation, we take them offline and deal with that by email. So members, we're now on to comms. Martin, over to you.
Thank you, Chairman. Good evening, everyone. So let's pick up on community testing. First of all, that's certainly been the the main focus for us over the past couple of weeks. We're continuing to promote testing in all of its different available formats. So that is whether it's at the community testing centre, at the mobile community flex service, whether it's at pharmacies. We've been working hard just to make sure it's as easy as possible for residents to know how they can access community testing and where they can do that. We've been working particularly with schools over the past week to get the message out, as Matt said, to parents of all school age children, but particularly those at primary school. So we've got a letter going out over the next day or so to schools where there's been cases of COVID confirmed over the past few days. We're going to be rolling that out, amended letter to all schools later in the week. Also, just to make sure we're getting that message out to parents of all school age children across the district. I think would be a really important message to get out. As well as using our regular channels, we've got COVID newsletter, which continues to go out weekly. We've got regular media briefings, we've got social media, we've been updating the website, but just to try and get that message out a bit wider, we've been doing advertising as well over the past couple of weeks. So we've had community testing adverts in the Legal Weekly News and also in the Reading Chronicle and in Penny Post too. We've been doing some social media advertising as well. So community testing certainly the focus for us over the past couple of weeks. Vaccinations have been another area we've been working hard to support. So that's both supporting the government's campaign to boost take up amongst under 50s and some guidance on pregnant women and what they should do with regards to the vaccine, which is to have it at the same time as the rest of the population. We've also been sharing vaccination information from our partners in respect of the changes which Jo outlined earlier at the Newton Graceful Vaccination Centre, the Public Health England and NHS test and trace contact testing, and also promoting that in the newsletter too. Other areas we've been working on over the past couple of weeks, hands, face-to-face and fresh air, just continue to promote that messages as people continue to meet out in outdoor spaces. We've had a new chairman appointed over on Tuesday at the annual meeting. So we took the opportunity with the outgoing chairman, Graham Pass, to record a nice video message thanking everyone for doing the right thing, in particular those community groups and public services which have been working throughout the outbreak to support local communities. And at the last meeting, you may remember that I spoke about a new community booklet that we have been working on to promote the work that we've been doing over the past year for the pandemic and give people confidence about our steps going forward. That is available online. We've also done some printed copies, which will be going out this week for pickup at community testing centres, in libraries, in Shaw House and in the museum. And we've also had some We've also had some adverts in the weekly news as well to post that. But I understand some of you are finding it hard to hear me, so I'm just going to try and adjust my microphone a second. Do bear with me. I don't know if that's any better.
A little better.
Thank you. Looking forward, community testing again will be another key area for us to promote, and we'll be, as I said, doing that letter going out to all schools later in the week to promote testing. We've got the step three changes which were announced this evening, which will be coming into effect next Monday. So we'll be promoting those changes to local residents to help keep them safe, so that they know what they can and can't do from next Monday. And we're also working on a campaign around parks and open spaces. We know that as people are looking to meet up with family and friends again, first outdoors, and particularly over the summer, and take advantage of the nice weather, our parks and open spaces will be busier than usual. So we're just working on a campaign to ensure that as people do use our parks and open spaces, they're able to do so safely and observing any social distancing regulations which remain in place. The campaign will look at another couple of issues as well around respecting the space and taking rubbish home, but social distancing regulations certainly will be part of that. So design concepts and messaging have been tested with community groups, and we'll be making a final decision in the next few days about how we can take that forward. So that concludes my presentation, Chair. Happy to take any questions, and if it would be helpful for me to go back over anything you didn't hear, I'm more than happy to do so.
Councillor Vickers.
Hi, thank you, Chair. I don't know whether this is a question for here or whether I should have raised it somewhere else, but it's sort of a concern about, as we're sort of getting back to some sort of normal, it's a concern about the people who are still frightened, and there's quite a few of them out there, and how we can help them, or is that just, we just, you know, just wait and see what happens. But there's quite a lot of people, particularly older people, who got so used to sort of restricting themselves and sort of keeping away from everybody, that they still are they're struggling to actually get back to normal. I suppose it's a sort of long COVID in a way, isn't it? So I don't know, do we have a role there, a reassuring role, or is that not something we're particularly bothered about?
Well, let me come to Matt in a moment. I mean, from my point of view, my perspective, and particularly with the portfolio I hold, I certainly don't think it's that we don't care about anyone who is concerned or frightened. And indeed, in a week where we are looking at the mental well-being of our residents, I think we need to do everything we can to explain to the residents and back up the messages that are coming out of government about where we are, what is going on in the district with regard to COVID, and what the rules are. Now, we cannot force people out of their houses, nor should we try to, but I think we can encourage them. And I'm certainly very keen personally to encourage people into activity, and the whole piece about the mental health well-being is to do with getting out and understanding nature and connecting with nature. And I'm keen on that personally, you know. Getting people out walking is one of the things I'm very keen on. And it's a great way of getting people to re-engage with society, to reconnect outside the house. So the more we can do on that front, the more I'm very keen on it. But I'll look to Matt and also to Martin to some extent to suggest ways in which we can endorse and enthuse those to get out of the house. Matt.
Yeah, I think I'd echo those comments, particularly about Mental Health Awareness Week. I think my view would be absolutely let's try and support those individuals. Obviously, we've developed really good working relationships with lots of community groups, whether that's befriending groups, whether voluntary sector groups, which we can link with. And I think it's about how we explain risk to those individuals, the balance of risk in terms of the things they need to do and the overwhelming benefits of connecting with people in a safe way. So that's certainly something we can take away and work with. I know that's something that's already been brought to my attention, so happy to progress that going forward and work with comms and other colleagues.
Thank you.
Anyone else want to comment, or shall we move on? Okay, we'll move on. Right, members, then the next item is future agenda items, and I'm going to link into that the question of future meetings. Now, arising out of the Mental Health Awareness Week, and Councillor Stewart and I have had a conversation about this, we are going to look to invite someone from Greenham Trust, might be Chris, might be one of his colleagues, along to, in a fortnight's time, to talk about the Surviving to Thriving application process and how that is doing, and there'll be more about it in that meeting. I've also suggested that I know that there's a piece of work going on to relaunch the Community Physical Activity Fund, which links into what I just said about getting people out and about and walking and so on and so forth. And that's another joined up piece with the trust. So what we'll try to do is get someone along from Greenham Trust to talk to us about how those two projects are doing. And then, unless anyone has any other suggestions for future agenda items, no, I'll move on to the question of meetings generally. Now, there was a paper to Gold this morning about engagement generally and LOEB particularly, which had in it a proposal that we should tie LOEB to the government's roadmap, and that proposed a final meeting on the 5th of July. Now, I had personally in my head tied these meetings in a similar way to the way that we're looking at the Community Hub meetings to the 21st of June, because the 21st of June, of course, is a date in the calendar that we're all, one hopes, looking forward to, perhaps with some trepidation in some angles, but we are looking forward to. So I think what I would like to suggest is that we certainly have meetings up to the 21st of June in our diaries, and we consider where we are as we approach that date and think about where we're going to with meetings at that point. So just to give you a steer, unless anyone has any burning desire to disagree with me, that's how I'm viewing the future of Local Outbreak Engagement Board. I see no one leaping up to have a word about this one. So I will now see whether there is any other business anyone wants to raise. And again, silence across the room. So thank you, members. I think that is all the business of this board for today. Can I ask, as usual, all members to stay in the room until we have confirmed that we are no longer streaming? Over to you, Gordon.